Hello and welcome to all of our viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And today I'm talking with Dr. Leslie Parker about her upcoming presentation for our Gold Neonatal Conference here of 2024. Welcome, Leslie.
Thank you very much.
It's wonderful to have you back here at Gold for the Neonatal Conference. Your topic this time is Time for a Change, Feeding Tube Dwell Time and Contamination in the NICU. I'm very excited about that topic. Before we hop into that, tell us a little bit about your background. I see you have your UF, University of Florida in the background. So talk to us a little bit what you do there.
So I have been at the University of Florida since about 1985. So I'm kind of aging myself there. And I began working as a nurse in 1985, and then I went on to get my neonatal nurse practitioner. And I worked there for several years, and I began to find so many questions about some of the care that we provide our infants in the NICU that didn't have answers. And so I made the decision to go back and get my PhD to see if I could answer some of those questions that I saw in the NICU in order to improve the care that nurses and other care clinicians provide these vulnerable infants.
Beautiful. Yes. As you mentioned, so many unanswered questions. So you'll go into research. Talk to me a little bit about some of the research topics that were of interest to you over the years.
So I have kind of two separate types of research. I do research on trying to increase the amount of breast milk that very low birth weight or preterm infants receive by providing interventions to their mothers to help them make more milk. And my other area of focus is really how to provide enteral nutrition in the best way to our babies. And so I've studied things like whether or not we should be using gastric residuals to guide our nutritional care. And again, with this, we're looking at optimal dwell time of feeding tubes. And finally, I've started looking at oral care. So how are we not just providing drops of breast milk into the baby's mouth, but what happens if we go in and systematically clean the baby's mouth? Will that decrease the contamination in their mouth? And will it improve health outcomes?
Fascinating topics. Yes, indeed. Oh, that sounds absolutely wonderful. And your topic here, the time for a change, feeding tube dwell time and contamination in the NICU. Let me ask you this. What are the protocols right now? And how did this become an interesting topic of interest to you? Have you seen infections? What led to this particular study?
Well, what I really like to do is find out those questions that people ask. And so I do a lot of lecturing around the country on topics related to infant nutrition. And sometimes I get a lot of questions, and I was getting so many questions about how often should we be changing feeding tubes? And I'm like, I have no idea. And the manufacturer says that we could leave them in place for up to 30 days. And that's good information, but it's only based on the integrity of the feeding tube, not related to contamination. And we know if we leave different aspects in the baby's body, like a central line or a urinary catheter, the longer those remain in place, the more contaminated they are. So why doesn't that hold true for feeding tubes? And so that kind of gave me the idea.
Yeah, and you would think, especially then for feeding tubes, right? There should, the contamination there. So, you will obviously present on this topic, but was there something that really stood out to you or surprised you in this area of studies when you dug into it?
Well, it actually surprised me as well as my entire unit, because I decided to start out with just looking at what we do in our unit. And the amount of bacteria that were in our feeding tubes was just astounding. It was like over 1 million colony forming units. And when we think about contamination being 1,000, we were just like 20 million in the hub or in the area that you place the syringe on the feeding tube. And that was like, oh, if that has that much bacteria in it, and that's infused directly into the baby's gastrointestinal system, what are we doing here? And so that was rather shocking to me. And that's why I decided to do a larger study.
Wow. Yes, absolutely. And especially these vulnerable little ones in the NICU, that are, often very preterm or have other, conditions that they're there for. So having all this, bacteria there, and I can only imagine that this could be detrimental to them. With regards to protocols, you mentioned the manufacturer says 30 days, this feeding tube can be left in place. What have you seen as from with regards to protocols in your studies? I mean, are they varying from, hospital to hospital, unit to unit, or what have you seen?
We actually did a survey about 3 years ago, and we surveyed neonatal nurses all throughout the country and asked them, did they have a protocol? And if they had a protocol, what was it? And if they did not have a protocol, how often did they individually change feeding tubes? And it was all over the place.
Hmm.
About 50% had protocols, 50% didn't, and they varied from every day to every 30 days to as needed. And so it was all across the plane. The majority, but it wasn't a high majority, but the majority changed them. I think it was like 55% or something, changed them every 7 days. But
Mm-hmm.
again, that was based on pulling something out of the clear blue sky, not looking at
The
bacteria
data.
within the feeding tubes. Yeah.
Right, right. What the research says. Yes, absolutely. That is really fascinating to me. I would think like assume that there are more protocols in place. We have protocols for everything, right? So it must have also kind of be surprising to you to see this kind of variety of either having maybe no protocol to as needed to as, maybe stricter, but not based on really on research, but just as I don't know how they, as they came up with it. So that is fascinating, and I'm really looking forward to this presentation that you have here for us. Now, Leslie, before I let you go, any last words from you to our audience? Anything that you hope that they will take away from this presentation, or anything you want to leave them with today?
Well, I think what I would like people to get from this presentation is to have an open mind. What should we do with feeding tubes? And also have an open mind regarding other types of questions that we have in the NICU, because kind of what you were saying, Kristen, is
Mhm.
that there's protocols for everything, but that's really for adults and pediatrics. For our tiny babies in the NICU, we have not had those infants for very long. So
Mhm.
there's not a lot of research. And so we have so many unanswered questions on how to guide our practice.
And so many questions, and for you, Leslie, that's a good thing. Lots and lots of research projects for you to keep working on, and
Exactly. I'll be doing it past my 100th birthday.
and it's probably also an inspiration for other nursing staff to maybe go into research and contribute to research, because you're right, it's fascinating because our preemies, they're getting younger and younger. A few years ago we didn't had our technology has advanced so much that younger and younger infants are able to survive and be in the NICU, which is a wonderful thing. But now, we don't really have any research based on that either. So, and we're not, the field of neonatal or NICUs is not that, compared to adult medicine or even pediatrics, not that long in the making. So you're right, there's many research subjects still available, and lots of questions still to be answered.
Exactly.
Well, Leslie, it's wonderful to have you here today again with Gold. It's been a pleasure talking to you, and I'm looking forward very much to your presentation here at the Gold Neonatal Conference.
Thank you very much.
And for our viewers now, some information. Our Gold Neonatal Online Conference will start in June, on June 3rd, to be exact, with an open access free presentation by Dr. Niels Bergman on skin to skin, of course. And we hope to see everyone there. Go to goldneonatal.com to find out more information on the conference and all the conference presentations. Thank you, everyone, for watching, and have a lovely rest of your day. Bye-bye, everyone.
Thank you.